Hi there. Hey, I'm Jenn Rice, and I wanted to jump in here today and talk about, what the heck is fatty liver disease? I've been doing a lot of reading on this last week because when I was in clinic the last few weeks, I was seeing just a lot of lab work come back of liver enzymes that were elevated, which is a blood test, ultrasound reports that came back that showed fatty liver disease. And I just, working in dermatology for so many years, I just haven't been that familiar with, the liver and all of those sort of readings from it. And since I've become more sort of involved in my own personal health, I really have dug into more of this. The liver is so important for so many things in our health that it seems like many people are kind of struggling with something called fatty liver disease. And thank you guys for jumping on. I really wanted to bring this up because I'm seeing younger and younger patients with this. So normally this is something that happens around age 40 to 50, which I totally fall in that category. And two of the main reasons it can come is because of alcohol, so heavy drinking. And then also a non-alcoholic disease would be something like yo-yo dieting, eating lots of sugars in general. So the real definition of fatty liver disease is when your liver is taking in more calories from fat than it can process. And I mean the kind of fat like, I don't know, probably a scone or, muffin. We're not talking about good fats, but lots of fats in general. And so we're seeing this rise in fatty liver disease in even children. So I was reading something Dr. Mark Hyman put out, who's a functional medicine practitioner, where he treated a 12-year-old boy with fatty liver disease, and he's actually on a liver transplant list because of the fatty liver disease from having tons of sodas as a younger person. Now, I'm not saying everybody that drinks a lot of sodas is going to end up with fatty liver disease. We're all unique and we're all put together differently, and there's a lot of factors involved, but I think being aware in general of fatty liver disease. So I don't know, I see you guys jumping on. If you've heard of fatty liver disease before, I just, let me know, because I don't know how common it is or talked about in, primary care offices. But it's a really easy thing to screen, and probably your doctor's already doing that. But if you're curious to know if you have this, because you don't necessarily have symptoms, next time you see your doctor, PA, nurse practitioner, ask them about doing some blood work to check your liver. And then if it shows, if the blood work shows something, they would send you on to the ultrasound. And that's where I was saying, these reports I was reading of fatty liver disease from an ultrasound report is what kind of got me concerned and looking into this a little bit more, because the ages of those patients were much younger than, what you mostly read about. And so symptoms, though, of fatty liver could be, fatigue and definitely obesity. So if you're overweight and obese, or someone or have a family member who is, and also if they're a type 2 diabetic, there can be a real increased risk of fatty liver disease. To the stats are like 75% increased risk of fatty liver disease if you're obese and type 2 diabetic. And so, when I'm looking at what is conventional medicine doing for this, what's functional medicine doing for this, and a couple things really. So, conventional medicine is sort of tracking with functional medicine as far as what they're doing for treatments for this. And that would be putting people on plant-based diets, putting people on an eating plan that makes sense, that's more healthy, asking patients to lose weight, getting the weight off as quickly as possible in a healthy way so that it stays off, not so that it comes right back. And then exercise. They always talk about, 30 minutes of exercise every day, and it, I sound like a broken record because I feel like every video is like eat better, lose weight, and exercise. And a lot of times I know people want a quick fix, like a pill or, something, which you can end up on pills for diabetes, pills for high blood pressure, pills for acid reflux. But if you want to kind of take, the bull by the horns with this, and you want to follow conventional medicine as well as functional medicine, doing those changes in diet are key. So if you're interested, you can reach out to me with a private message or comment below. I can send you a list of the foods that we recommend for, mainly in what are the key foods that help with your liver, help to improve your liver. They also talk about, of course, cutting sugars as much as possible, fructose especially, and then making sure that you're taking care of yourself as much as you can. So I hope that you guys got some value from this video. If you know someone who's struggling with their weight or is potentially feeling any of these symptoms, make sure that they've had a liver screening. And I'm going to be coming live next week and doing the top 5 concerns that people have had about their health throughout 2018, and kind of hitting on those topics with diet and what functional medicine versus conventional medicine does for these. And if you guys are interested in that, you can hit when you get a notification when I go live. That would be great. And thanks so much for watching. Have a great day.